Where my girls at? Where my girls at? Independent, free spirit. Ooh, it's something serious. Where my girls at? We ain't linked up in a cool minute. Where my girls at? It's going down, down. Where my girls at? It's going down, down. It's going down tonight. We going out tonight. Yeah, right. We going out tonight. It's going down tonight. Yeah, right. It's going down tonight. We going out tonight. Yeah, right. We going out tonight. It's going down tonight. Yeah, right.
When my girl said it's going down on a Talk About It Tuesday. And boy, do we have some things to talk about today. We want to welcome you to We Got Issues with the Force of Friendship on 9:10 a.m. The Superstation, which is right here in Detroit, but is heard all over the world. I'm your host for today, Crisette Ellis, and of course I'm with my girlfriend Sabrina Goodwin Monday is in the house. Glad to see her sporting her new look. We're going to talk about that in a few minutes, and then we also have Caterina Harris Earl. She's not on Facebook Live with us today, but she is on the radio, so we're glad to have her. And you know what? We just got off a Zoom with Gloria Mayfield Banks discussing business. She's all the way on the other side of the world in Africa, and it's about 1 a.m. in the morning, and they have a 4 a.m. flight. So she is packing as we speak to get on another plane headed somewhere around the world. So, I mean, it must be nice to be able to travel for almost a month, okay, from this place to that place and every place in between. And so we are so glad that she is enjoying herself. So if you haven't been checking out Gloria on her social media, you absolutely need to go and just envision all of the wonderful places in the world that you want to visit. She and Ken has had an amazing time traveling around the world. Well, you guys, it's Tuesday, and you know how we do. We talk about a little bit of this and a little bit of that, but I am so excited. On today, we are going to be talking to the Chief Medical Executive Officer for the state of Michigan. Dr. Natasha Bagdasarian is with us on today, and we're going to be talking about COVID vaccines. And you have questions. I know I have some questions, so we absolutely want you to engage on today. So call us at 313-778-7600 with your comments, your questions. Hey, do you have a feeling like they're not saying a whole lot in the news anymore about COVID, about the pandemic? Is it still something that we should be cautious and careful about, or is it starting to wane? Should I get another shot? A new vaccine has just come out, so she's going to talk about that. Our children have gone back to school. Did you vaccinate your child, or are you still like, I'm not really sure I want to give my child the vaccination? So we're going to talk about it all. So again, we want you to give us a call. If you have a question, I promise you, the doctor is in the house and she can answer every single question that you have. And so I am so excited about our topic for today and what we're going to be talking about. And we also have a PSA, or we're going to talk about something that's going on in the city of Detroit in just a few minutes. We absolutely, for those of you that live in the Detroit metropolitan area, there's an event that's going to take place on tomorrow that maybe you've heard about it, or maybe you haven't. So we have a special guest that's going to pop on in just a few minutes to tell us about this event. It's a day of peace and healing in the city. So we want to hear about that because I don't know about you, we absolutely need some peace and we need some healing in Detroit. And I'm sure every metropolitan city across the country could use some peace and healing. So before we go to her, just want to check in with the girlfriends and see how they're doing. You guys, if you are listening, awesome. But if you want to check out a new hairdo on one of the girlfriends, Sabrina Goodwin Monday, I've been trying to get her on the other side to join me with braids. And you know what, you guys, when life happens and you move the way she and her husband, Kenny, has been moving, trust me, she made a decision to join the braid club. So Sabrina, talk to us. How you doing? How you doing?
Oh my goodness, it's a terrific, terrific Tuesday. We are here. I'm so thrilled we have a doctor in the house because when I tell you I'm confused, I said I'm tuning into our own show to get education, information, understanding for sure. So, Chris, it's a good day in the neighborhood. Yes, yes, yes. To all of our viewers, all of our listeners all over the world, thank you for being part of the Force of Friendship tribe. We're growing every day and we welcome you. If you're a first time listener, first time viewer, type your name in the chat. Call us 313-778-7600. Everybody should have a question about the pandemic. COVID-19, is it over? The president said it was over, but I don't know about that because I was in Starbucks today and this man was coughing up a storm. I moved so far away from him. But anyway, we are glad that we have a doctor in the house to give us some answers. Yes, I'm still loving my braids. I am. It's so easy. I'm getting comfortable. I'm getting used to them. Haven't had them in 20 years, and I am loving them. So, thank you, Crisette Ellis, for the inspiration. Thank you, Michelle Obama. When she showed up at the White House with them, I said, okay, 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 let's go. So, lots going on. I want to tell all my fellow TikTokers, y'all don't be doing cooking no chicken and NyQuil. You know, there's this big challenge. Have you guys heard about that challenge? Cooking chicken
No.
and NyQuil. Yes, it's this
Crazy,
big challenge, and
crazy.
it's real crazy. And so we've got to. You guys don't fall for the okey doke. CDC says it's dangerous, and don't do it. But this is how impressionable our folks are on social media. Life is not a game, so cooking that chicken and NyQuil is a no-no. Don't do it. So lots going
Why?
on. I Go ahead, Katrina, who's on
Why
Ain't
radio.
would you
doing
have
it.
to?
Hey,
Why would a doctor need to tell you that chicken and NyQuil is a bad thing? Why is that necessary, Sabrina? Why? Why? Why?
The
hey,
world we live
Katrina.
in. The world we live in.
Katrina,
Yes. Go,
before
Chrisette.
you talk about what's happening in your world in the Los Angeles or in the California area, I want to go ahead and bring on really quickly one of our guests who's going to talk about an event that's taking place in the city of Detroit. Pastor Ovella, are you with us? Are you there?
Here. Yes, we are here. Yes, we can hear you. Well, thank you so much, Pastor Ovella. Let me just tell you just a little bit. Thank you about her. She's the founder of Code 22 Peace and the Healing Movement. Each 22 is officially the Day of Peace and Healing, adopted by proclamation in Detroit and 13 additional cities. It's a call for all to their right on the 22nd and be intentional about promoting peace in some way. Our hope is to reduce violence by shifting the momentum. So, Pastor Ovella, just real quickly, tell us about this event and why it is so important.
Well, Sister Crisette, first of all, thank you for allowing me and the time to be with you, and good evening to Detroit and all of the listeners. Yeah, so Code 22 is really a call for peace. We are in our organization in the business of the reduction of crime through the promotion of peace, healing, and positive change. We want to reduce crime by promoting peace. And so for 11 years, we have been doing events on every 22nd of the month called Code 22, and that's what it is. It calls people to a consciousness about peace every 22nd. And so we've done a number of events, a number of initiatives. But what's coming up on this Thursday is by far is going to be the most engaging because everyone can participate. And you all know that the violence and the crime and the death is all darkness. It just puts a black blanket across our land when we think about the babies that are being died, the babies that are killed in gun violence. And so the vision came to just call the city in white. But what if we all said we want to promote peace? So one day, even though it's after Labor Day, we all wear white so that we can promote peace, so that we can have a collective consciousness about being in agreement that we need more peace and that we're going to do what we can to combat this violence. And of course, we don't know what to do because if we knew what to do, we'd solve it by now. But this is something we all can do. And our hope is that, every day we hear breaking story, top story, shooters here, 2 people killed. So it's like, we want to just, if we can shift the momentum for just one day, that the media says, you know what, the whole community, the churches, the bars, there's Crime Stoppers, there's people that are just operating this daily in the community. The Detroit Public Schools, all of the students are wearing white on Thursday the 22nd to promote peace. So it's a call to everyone to say, let's wear white, let's be intentional about promoting peace. Let's try to calm ourselves, calm this violence. And the greatest thing, Sister Chris said, is we have 150 T-shirts donated to us with Code 22 on the back. And some of our organizations are connected to inner city, some of the guys in the gangs, asking them, put the guns down for today, put on a white shirt, and let us all just have a day of peace.
Wow, that is so powerful. And what a visual, visual. And so I think this is a start. And as you said, you've been doing some various events, and I know that there are additional events that are being planned. And Pastor Bella, we absolutely are going to invite you back to tell us more about some of the other events because we absolutely need peace and we need healing. And this is just a start. So one more time, we want to encourage those of you that are in the city of Detroit, the Detroit metropolitan area, to absolutely pull out your white. And you know what? The rules are gone. You can wear white after Labor Day and in November, in December. That rule is over. So pull out your white. And you know what? In the city of Detroit, we have absolutely amazing weather. So you absolutely can wear your white. So Pastor Bella, thank you so much for being with us on today. As I said, we will absolutely have you back so that you can talk about the more things that you and your group are doing in the community to promote peace and healing.
Thank you so much. God bless you all. Thank you.
You're welcome. All right, Caterina, real quickly, I know we only have a few minutes before we go to our first break, and then we are going to meet our guest, and it's going to be all about COVID vaccines and use. So before we go to break, Caterina, talk to us what's going on in your neck of the woods.
Oh, so much going on, Chris. There's so much going on. I just want to say what I reported yesterday about earthquakes. 7.2 in Taiwan and 7.5 in Mexico, Santa Rosa, California, near Napa, wine country. Earthquake yesterday. Paying attention.
Wow.
So, yeah, that's getting close for comfort. It's a lot of shaking, a lot of quaking, a lot of flooding. It's a lot. It's a lot. Keep looking up, but pay attention.
Yeah, we absolutely got to pay attention. And you know what? We absolutely have to do another show on climate control to just talk about some of these things that are going on around the country, which we know can all be pointed to because of the climate change and things that are going on in the earth. And so thank you, Caterina. You still ain't got that U-Haul truck out there. They're not bad enough for that U-Haul truck just quite yet. So I just hope you have them on speed dial.
Earthquake, you need an airplane. Earthquakes, you need an airplane.
What'd you say? You need an airplane. I heard that. are back. We are back, and you are listening to We Got Issues with the Force of Friendship on 9:10 a.m. The Superstation. And we're excited to be with you on this Talk About It Tuesday. Thank you, Jalen. Thank you for that round of applause. Well, you guys, we're getting ready to get right into a very important conversation. And I am so excited, so thrilled to welcome to We Got Issues the Chief Medical Executive for the state of Michigan, none other than Dr. Natasha Bagdasarian. Let's bring her on. Let's give her a big round of applause. We're excited to have Dr. Bagdasarian with us on today. And before you meet her, I just want to give you a little snippet of her bio. Her bio is long because she is a phenomenal, amazing woman. Dr. Natasha Bagdasarian is a medical doctor, and she was named the Chief Medical Executive for the state of Michigan in 2021. In this role, she provides overall medical guidance for the state of Michigan as a cabinet member of the governor. She is board certified by the American Board of Internal Medicine in both internal medicine and infectious diseases. And she is a fellow of the Infectious Disease Society of America. So again, we want to welcome to We Got Issues, Dr. Natasha Bagdasarian. Welcome to the show, Dr. Natasha. We're excited to have you on the show. So you know what? We're going to get into some questions that I know has been on a lot of people's mind, including mine and Sabrina and Caterina. So we are excited about this opportunity to talk to you, to get some of our questions answered. And for those of you that are listening, and even for those of you that are viewing us on the 9:10 a.m. Facebook page or the Force of Friendship Facebook page, put your questions in the chat. But you can also call in with your questions or your comments at 313-778-7600. So Dr. Natasha, we are so glad again to have you on the show. So just tell us a little bit about yourself, a little bit more, and then we'll go right into some of the questions that I know are on so many people's minds.
Well, I'm so glad to be here with you all. I think this is a fantastic forum. I love the fact that this is a group discussion of strong women who have thoughts and opinions, and I'm so happy to be part of this.
Well, we are certainly excited to have you with us on today. And again, I know that so many of us have questions about what's going on with the pandemic. And I'll just say, of course, if you go back to 2020, all the news media that was on 24/7 is all you heard was the pandemic and COVID. And then, of course, we know the vaccines came out and we heard a lot about that. And so now we are here, September 2021. And it just seems like we're not getting as much coverage. But I do believe that the pandemic is still out there. So can you just kind of talk a little bit about where we are right now and maybe why we're not getting as much coverage?
I think it's unfortunate. There's a lot of COVID fatigue. People are tired of this pandemic. People are tired of talking about COVID. And if you think about how our lives have been disrupted over these last 2.5 years, we've all missed stuff. We've all given up things that are really precious to us. We have missed weddings. People have missed funerals. They've missed family gatherings, annual events that we're used to going to. And I think some of the trauma of that has led to where we are now, where people just don't want to talk about COVID. But it's unfortunate because COVID is not done with us. And in fact, COVID is going to be with us. And I'm talking about the indefinite, foreseeable future. This virus is not going away. So in the beginning, when we had a handful of cases in the world, there was an opportunity to sort of stop transmission and stop the spread of this virus. And maybe we could have been in a situation where we were not in a global pandemic. But now that it has spread to every country, now that it has spread in the way that it has, there is simply no avoiding that COVID is going to be with us. So that's the bad news. But the good news is a couple of things. Number one, COVID is getting more predictable. So we are able to look at, we're not limited to just what happened last week, the way we were in the early days of the pandemic. We can now look back and say, what happened at this time last year? What happened the year before? So we've got 2 years of data to look back on. And we know when COVID tends to peak and when it tends to surge and when it tends to go down. So number one, we are getting better at predicting what this virus will do. And I'll talk a little bit about that and what it means for us in the upcoming months. But number two, we have tools. And that means that this disease is preventable, which is huge, and it's treatable if you get it. So it's not done with us. COVID infections are still happening at a pretty significant clip. So right now, the daily case numbers in the United States are 54,000 cases per day. And that's cases we know about. That's not including people who are testing at home. And people are still dying from COVID. Over the entire United States, we're averaging about 350 deaths per day. But that's over the entire United States. And it's much more treatable and preventable than it was in the early days of the pandemic. And I want to tell your viewers and your listeners how to keep themselves safe.
Oh, wow. That's good. So we absolutely need to know how to stay safe. You know what? Let me regress just for a quick minute, because I know that there are a lot of listeners, especially in the Detroit metropolitan area, and those that are watching. Can you real quickly talk to us and tell us, how did you end up becoming the chief medical executive?
Well, I am an infectious disease doctor. And when I went to medical school, so I trained at Wayne State in Detroit. When I went to medical school, my whole goal was to work in infectious diseases on outbreaks and pandemics. So for me, I've been preparing my whole life for this moment. And keeping Michigan safe and keeping communities safe is really everything that I have ever worked towards. How I got into this position is a little bit of right place, right time. So I had been living and working overseas. I was in Singapore, I was in Dubai, I was working for the WHO on outbreaks and pandemic prevention, coincidentally. And I happened to move back to the US in July of 2020. And I interviewed with our then wonderful chief medical executive, Dr. Jonay Khaldoun, who hired me as her right-hand man, her right-hand woman. And I worked hand in hand with her for the next year and a half of the pandemic. And we sort of did everything together. We were in sync. And I did a lot of behind the scenes stuff. She did a lot of in front of camera stuff. And then she took another job opportunity and recommended me for her job.
Wow, that is just so powerful. Absolutely powerful. And I love the fact that, we know men can handle the job, but I'm so elated that we have it, that the chief executive medical officer went to another female. So that was really exciting. So again, congratulations on landing that job that you have prepared for your entire life. So that is exciting. So Sabrina, I'm going to throw it over to you because I know you have some questions. I mean, the girlfriend said today they were excited to have you on because we know that our guests have questions, but we have as many questions as they do. Sabrina.
Hi, Dr. Natasha. Welcome to We Got Issues, because when I tell you, COVID has given us many issues. And quite honestly, we're just so grateful that we're breathing, we're living, that we survived the pandemic. And because so many have been lost through these last 2.5, 3 years. My first question is, I got a vaccine. I'm not trying to be selfish and ask my personal question, but I got my 4th booster in July. And so now they're talking about this new booster that's coming out. Those people who just got their 4th booster, what are your thoughts, Dr. Natasha?
Yeah, I'm happy to talk about this because there's a lot of confusion out there. And even doctors out in the community are confused because there have been so many regimens at 1st booster, 2nd booster, 3rd booster. I mean, it's a confusing landscape. So the good news is that, when we talk to our partners at the CDC, they're talking about how they want to make this simpler as well. So it's going to transition more the way we talk about flu shots and did you get this year's COVID vaccine? So in the future, things are going to move to that direction. But where we are now, it's really important for your viewers and listeners to know that there is an amazing new vaccine, and that is the bivalent or the Omicron booster. And this is a booster that not only covers for the original COVID, but it covers the new variants that are making up about 99% of our cases in the US right now, and that's BA4 and BA5. So this COVID vaccine is going to be a powerful tool to protecting us against surges this coming fall and winter. And anyone is eligible. So we'll talk about adults first because it gets a little bit more confusing with kids. But for those ages 12 and up, you're eligible if you've completed your primary series and you are 2 months or more out from your last shot. So we're no longer counting how many you've had. If you are 2 months out from your last shot, which you are, then you can get that bivalent booster. I got mine last week. I did flu shot in one arm.
Dr. Natasha, that's the music, and this is so important. So we're going to go ahead and take this break. And when we come back, we absolutely want to continue the conversation about, how close to the last booster you should take the new vaccine. So you guys are listening to We Got Issues, 9:10 a.m. The Superstation. We are here with Dr. Natasha Bagdasarian. We're talking COVID, vaccines, and you. We'll be right back after this break. We are back. And you're listening to We Got Issues with the Force of Friendship on 9:10 a.m. the Superstation. And we're excited to have our guest on today. Dr. Natasha Bagdasarian is with us. She is the Chief Medical Executive for Michigan. And we're talking COVID, vaccines, and you. And so if you have a question, we absolutely want you to call in because she's the expert on today. The number to call is 313-778-7600. Dorothy said, that's great information about when you can get the booster. Doesn't matter the number of shots you've had, just how long since your last shot. So thank you, Dr. Bagdasarian. So our viewers are loving this conversation as well. So right at the break, you were telling us about the new shot and how it works. So if you can go ahead and update us on that, that'd be great.
So I think I covered most of the information about anyone is eligible. The bivalent booster is a really, really helpful tool. It's going to keep our communities safe this upcoming fall and winter because it protects against the variants that are circulating right now, as well as the original strain of COVID. So not only is this as safe and effective as the prior vaccine, this is going to be more effective because it gives you that broad coverage of the old COVID that was circulating as well as the new. So it's going to keep people out of the hospital, keep them out of ICUs, keep them from, dying from COVID, which is really what we want to do. And anyone is eligible if you are 12 and older, if you have completed your primary series and it's been 2 months or more since your last dose of COVID vaccine, you can get this new booster. And it is available in pharmacies, local health departments, and healthcare settings around the state. And don't worry about getting the wrong shot, getting the old shot. The old shot was pulled at the same time the new boosters were approved. So the new boosters are widely available, and both Pfizer and Moderna make them. So you have a couple of different options. For kids, it's a little bit different. So for kids under 12, we are still waiting for approval for that updated booster. They do still have the monovalents, the older boosters available. So if you are preparing for a family vacation, a family gathering, you just want to have that extra protection, now is still a good time to give your under 12s that booster. But the new boosters for kids are expected to come out by probably November. And so personally, I am going to wait to vaccinate my 8-year-old with that bivalent booster when we get the new shot in November.
Wow. Okay, great. So
I got a quick
Quick
question. Okay, Dr. Natasha, they say too much of a good thing can be too much of a good thing. Seriously, how much is too much? How much is too much of the shot?
So, our bodies are actually subjected to what we call antigens or proteins every single day, unimaginable amounts. So if I'm walking outside and I'm getting, and I'm breathing in pollen and grasses and trees, or if I'm with my dog or my cat and I'm breathing in all of those animal danders, my body is seeing those antigens and is dealing with them every single day. And it's trying to determine whether or not something is an okay protein and it can ignore it, which it does for the most part. With 99.9% of things it comes into contact with, it will ignore and know that it's just part of life. And then we are also getting bombarded with proteins from viruses and bacteria. So there are millions of bacteria living on our skin, living in our gut, and our immune system is seeing those every single day. So if we did not have that sort of interplay between immune system and all of these proteins, we would succumb to everything. So the amount of protein that we're getting in this virus is minuscule. It's nothing compared to what our bodies are dealing with every day. So I know it seems like a lot, but we always do a risk-benefit analysis before we advise our patients or our communities to take anything. The risk of seeing or getting exposed to COVID is much, much worse than any potential risks from getting the vaccine. And these vaccines have been studied more than any vaccine on the face of the planet. They have now been given to millions of folks and have been very, very well tolerated. So in fact, I don't see the vaccine as something to be hesitant or fearful of. I see this new type of vaccine, the mRNA vaccine, is a key to making medicine better. We can start developing vaccines for things that cause cancer. We can start developing vaccines for all kinds of things. The sky's the limit now, because this pandemic, if we take a silver lining, one of the silver linings is this amazing new vaccine technology. And I also want to tell your viewers, your listeners, I would never recommend something that I would not take myself or give to my own family. So I'm vaccinated and boosted. I made sure my husband was vaccinated and boosted, my mom, my sister, my 8-year-old son. So I would never tell you to take anything that I didn't feel comfortable taking myself.
Awesome.
Excellent. Thank you
We're
so
gonna
much.
go.
Thank you.
Yes, we're going to go to a caller, and after the caller, Caterina, we're going to go to you. Shamir, are you on the line?
Yes. Okay, okay, I don't want to interrupt the show, but you're saying the vaccine is already very safe, correct? Okay, can you hear me? Yes, we can. Sorry. Yes, also, yes, well, I know of 9 people, personally, family that took the vaccine, it was in perfect health, and they ended up dying from it. I'm not, I'm not exactly, I'm not just saying it, but I know, 9 people I know for sure, personally. There's one lady, auntie of mine, she's in Mississippi, and they just teach, seeing her, and she was like, 60. She took me my happy birthday, she died. Miss Mamie died for taking the vaccine. So how we say this 100% safe? I know of 9 people now. What I've done, I'm a 69-year-old black male, and I started preparing for the virus when it first came. I've been in the health for all my life. And I had preparing about the virus. It was the worst of it. I overthrew it within 10 days. And I wasn't in good shape the first time. And I've done it through not taking the vaccine. So how could you say that that is safe? I know 9 people died. I know of 9 people personally died after they taking the vaccination. So how can we justify it? Can no type of has some few on the line of this, maybe kind of cancer and things like that, overweight. So how can we see? Okay, Shamir, let Dr. Natasha answer your question. So his question is, how safe is the vaccine, considering he said he personally knows 9 individuals.
The vaccine, and they pass after taking the vaccine.
So first of all, I just want to tell you that I'm so sorry for your loss, because that is a tragic thing for you to go through, for them, their loved ones. So I'm sorry for your loss. I can't comment on those individual cases because I don't know the details, but what I can tell you is that the studies around these particular vaccines have been so in depth and so much more than what we normally do with vaccines, because so many people have received this vaccine. We've never in the history of, in our lives, we've never had vaccine rollout like this. This has been the largest vaccine rollout ever. And so when we look at the millions of people who've received the vaccine, the number of people with adverse events are incredibly low. And in fact, every adverse event, anyone who takes a vaccine who has any problems at all, there is a website where they can go and report those side effects. Their doctor is required to report those side effects, and it gets compiled into a database. And so when we look at millions of people, which is always a different picture than when you look at, a small group of people, what we have seen is the vaccines are incredibly safe, and they lower your risk of dying from COVID, which is the ultimate goal here. But again, I'm sorry for what you've experienced and for what your family and loved ones have experienced.
Shamir, thank you so much for calling in, and absolutely, we are so sorry to hear about the losses in your family. Thank you for calling. We got issues. We have another caller. Harry, are you there?
Yes, thank you. I have a comment and a question for your guest. First of all, the latest COVID booster has been authorized without any human trials. And I'm getting at the NBC News website. You can Google it. New vaccine has no human trials. So they authorized the newest version of this without testing it on anybody. So I don't see how it's claimed to be safe. And then also my question is, if the vaccines are so safe, beyond a doubt, safe, then why do the manufacturers have an indemnity against lawsuits or anything like that? What I'm saying is, like, if you were to get sick or if your family member was to die, you cannot manufacturers to sue them for releasing a booster without testing it on people. It's almost like they're telling you, okay, they're perfectly safe, take it at your own risk. And I think a lot of people would be more interested in taking it if they knew the manufacturers were willing to stand behind the safety, not just put people on the radio to say it's safe, but they really ready to put their money where their mouth is and answer lawsuits. The VAERS reporting vaccine adverse effects reporting system has recorded thousands of deaths from myocarditis in children, heart problems.
Harry, let's let the doctor answer your question because we have several other callers. Dr. Bagdasarian?
I think those are really good questions. I'll answer the first part. You had mentioned that the new bivalent vaccine was released without any human trials, and that's not exactly true. What they were unable to do because they were trying to get it out by the fall, they didn't look at outcome data in terms of efficacy of the vaccine in humans. So what they didn't look at is if I take the bivalent booster and someone else takes the old booster, which one performs better over the next 6 months if we're exposed to COVID, because that takes a lot of time to do. But they did do the safety trials. So the efficacy.
Doctor, I'm sorry. Okay, we're going to go to this last break, and we absolutely want you to finish your thought and answer Buck's question. So after this break, we're going to come right back. You're listening to We Got Issues on 9:10 a.m. The Superstation with Dr. Natasha Bagdasarian, the Chief Medical Executive for the state of Michigan. We'll be right back after this break. are back. We are back. You're listening to We Got Issues, 9:10 a.m. the Superstation. And wow, I mean, the time has just almost really gotten away from us. This has been such a lively conversation. So right before the break, Dr. Natasha, you were talking about the efficacy and how the new vaccine has been tested. So can you tell us, finish your thought there? And then Caterina, I know you had a question.
So what I was responding to your caller was that even though they didn't do that long term, what is the efficacy of the vaccine in a real life environment? So look at it for 6 months, watch people over the winter, because that would have meant we would have not had these vaccines for the winter. They still did the safety trials. So the safety trials were done, and then they looked at antibody levels. So they looked at antibody levels in humans after receiving this new vaccine, and they looked at safety in humans with the new vaccine. What they did not do was, let's take 6 months and see how people do in real life. Does it prevent hospitalizations? Does it prevent death? And that's because time was of the essence, because the sooner we could have the vaccines before the winter surge, the better. And also because we have so much safety data from before. And a couple more points I wanted to make. I know that there are reports of deaths. There are reports of myocarditis, pericarditis, people dying. And I know that that is troubling, but it is, we can never say that a vaccine is 100% safe, that nobody has had a negative outcome from a vaccine. But what we can say is that the risks are infinitesimally, I can't say that word tonight, I'm sorry. The risks are very small compared to the risks of COVID infection. And when we compare the two, the risks of COVID infection far, far outweigh the risks of vaccination. And the last point I'll say, so that the law and the indemnity part, I'm not a lawyer, so I should not be commenting on this at all, but I will say that none of these vaccine makers are altruistic. None of them are making, I'm sure that there are good people who work for the pharmaceutical companies, but they are doing it to make a profit. And the side effect is that we all benefited from this amazing product. And so the indemnity, I'm sure, is because their bottom line is they wanted to make as much money from this product as possible, but it is an exceptionally good product. And I will also tell you that I have never in my career accepted a dime from any vaccine manufacturer. So please don't think that I'm on anyone's payroll other than the state of Michigan. And my only responsibility is to keep you all safe. I do not care about anyone's profit, politics, bottom line, nothing. I'm an infectious disease doctor first and foremost, and I took an oath. And so I would never provide information that I thought was inaccurate.
Thank you. Thank you. Harry, thank you so much for calling in. We got issues on today. We appreciate your question and your comments. Caterina, I know you had a question.
Yes. Oh, this is such a great conversation, Dr. Natasha. And of course, we just applaud your the science. We applaud your professionalism and absolutely applaud your integrity. Thank you for coming on. We're going to need you to come back again. Hopefully not because there's a research, but that's my question is, can you just speak directly to what the president said about COVID being over? How do you measure that? And are we more likely than not to have a resurge as we go into the winter months?
Excellent questions. All these questions and this whole discussion has just been amazing and so fun. I will say that we are clearly in a different place than we were in 2020. 2022 is nothing like 2020. So there are still people getting sick from COVID. There are still people ending up in the hospital, and there are even people still dying from COVID, but nothing like what it was at the beginning of the pandemic. And that's because we've got tools. The vaccine, of course, is the foundation. It is a pillar that we have and really, really helpful. But we've also got over-the-counter tests. We've also got therapeutics. And there are amazing therapeutics out there. The first I want to highlight to you all is Paxlovid. So this is an antiviral pill that you take for 5 days. You take it at the beginning of your COVID course if you do get infected. And it significantly, by about 90%, reduces your risk of ending up in the hospital, in the ICU, or dying. So amazing tools. And that's why we're not seeing the number of deaths now than we saw 2 years ago. But in terms of what the future holds, COVID is with us. And what we can hope for is that it will continue to become more predictable, and likely it will end up like a more predictable seasonal virus. So the same way that we see flu surges at a certain time of year, that is the hope, that COVID will become more of a seasonal virus. But we're not quite there yet, because remember, we had that little surge of COVID in March and April and even May.
Yeah.
And that was from a new variant. So as long as there are new variants coming out, we will see surges at tricky times of the year. But we've got the tools. We've got the tools. So if we make sure that as a community, as as people existing together in Michigan and knowing that our decisions affect those of others, if we make sure that we are vaccinated, that we have been boosted, that you've got a supply of masks and over-the-counter tests at home, and that you know how to get medications like Paxlovid if you do get sick, or know if you're eligible for those types of medications, then we can survive this. We can prevent deaths. We can prevent people from ending up in the hospital. And that's the goal.
Wow, that's so good. That is so good. So let me ask you, I know we are coming up on our last break. Well, we're actually going to end in just a few minutes, and we want to wrap up real quickly. Do we still need to be concerned about wearing masks? Do we need, I had a doctor's appointment today, and right on the door it says no entry without a mask. So how powerful are masks? Should we still be masking up?
So masks are still a tool, but we're in a much different place than we were a couple of years ago. And so now there are recommendations about masking, but we don't have that same statewide mandate to mask. It's more of a personal decision. So I still choose to mask. My family still chooses to mask. My son masks when he goes to school. He actually does not want to stop masking. I still mask when I, go to the grocery store, and I dine outdoors. If I can find a restaurant with patio dining, I will dine outdoors. So it's a personal decision, and a lot of it has to do with your risk benefit and your risk assessment of you and your family. So the questions I would say is, are you someone who is vaccinated and boosted? And if you are, then you're significantly more protected than those who are not. Are you someone who is over the age of 65? Again, elderly people tend to have more negative outcomes from COVID. Do you have a lot of other medical issues? Do you have diabetes? Do you have heart trouble? Do you have lung problems? Are you immunosuppressed? So if the answer is yes to any of those questions, then again, your risk threshold might be a little bit different. So it is really up to you. And then of course, if you're going into a building or a facility, like a healthcare facility where they're recommending masks, we do advise that you follow those recommendations. But it has become a personal decision. And that's another reason why things are so different now than they were in 2020.
Wow. Thank you so much. I mean, this is a conversation that I wish we had even more time to, ask some more questions about what other, vaccines that we need to take a look at. I absolutely wanted to know, if you're getting this new vaccine, do you still need to get the flu shot? I mean, can you get one or the other? And if you had to choose between the two, which one would you choose? Or would you say you absolutely need to have both?
I definitely recommend both. I definitely recommend both the COVID vaccine and the flu shot. The COVID vaccine, of course, is incredibly effective. Flu, we never know year to year, but get them both. Do one in each arm. That's what I did.
Okay, one in each arm. You guys, what a great conversation today with the Chief Medical Executive for the state of Michigan. We talked about COVID vaccines and you. And Dr. Bagdasarian, thank you so much for bringing all of this information. We absolutely got to have you on. We had several callers that we were not able to get to, but we're going to bring you back for a part 2. So again, thank you so much for being on. We got issues on today. You guys, thank you. We will be here tomorrow from 6 to 7 p.m. You've been watching We Got Issues and listening to The Force of Friendship on 9:10 a.m. The Superstation. We'll see you tomorrow. Bye-bye, everybody.
Thank you.